stomach conditions, no medications, no smoking, and your diet and exercise look really good. I would classify your activity level as moderate because you're active almost every day for at least an hour. I calculated your BEE, which refers to a balance between your energy or calories you intake with the energy expenditure. And to prevent weight gain, you want this to be balanced. So I took your typical day's diet, did the math, and you don't fall short or exceed your energy requirements, which is good because the total energy you need to stay at the same weight is about the same looking at your 3-day average, and this is about 1,883 calories. You're also at a healthy BMI of 21 for your height and weight, so you don't need to lose weight. You don't have any health considerations that require an additional nutritional increase. Before we cover your plan, are there any goals you may have for your daily diet or anything you might want to improve on in regards to your exercise, your health, or your weight loss?
No, I don't think so. I'm happy with how things are now. So.
Okay, great. So we'll just kind of cover everything and see where your nutritional intake is then. In a 3-day analysis of your diet, on average, you have adequate intake of all your grains, fruits, milk, and meat and beans categories. You should have an increase in the vegetable category. You're within 2% of your required kcals, protein, carbohydrates, vitamin C, thiamine, riboflavin, niacin, folate, B6, B12, calcium, phosphorus, iron, zinc, and selenium. The areas you do need to add to are fiber, vitamin A, vitamin E, magnesium, and potassium. I would recommend that you decrease your saturated fat and your sodium intake. A high saturated fat diet can make you at risk for cardiovascular disease, obesity, and cancer. A high sodium diet can make you at risk for cramping, hypernatremia, hallucinations, disorientation, lethargy, and possible coma. Lack of vitamin A can increase the risk for xerophthalmia, blindness, cancer, and dry, scaly skin. Vitamin A is also associated with the tissue and bone development, so to keep a healthy mouth, vitamin A is necessary. You could increase your intake of dark leafy green vegetables, which is what you're lacking in the food pyramid. Eggs, milk, cheese, butter, meat, and fortified cereals. Lack of fiber. Fiber is needed to prevent constipation, diverticulosis, coronary heart disease, and can lead to colon cancer. You can increase your intake of unpeeled green vegetables and switch to whole grain breads and cereals instead of the white breads. A lack of vitamin E is associated with an increased risk of cancer as well. Vitamin E prevents inflammation of the periodontium and promotes integrity of cell membranes of the mucosa. You could increase your intake of nuts, seeds, whole grain breads and pastas, vegetable oils, and fortified cereals or oatmeals. Lack of magnesium can lead to neuromuscular dysfunction, personality changes, muscle spasms, convulsions, tremors, hyperexcitability, anorexia, nausea, apathy, and cardiac arrhythmia. Orally, there can be hypoplasia of enamel and dentin, reduced alveolar bone formation, widening of the PDL, and gingival hyperplasia. You can increase your intake of nuts again, beans, green leafy vegetables, and whole grains to increase the magnesium intake. Lack of potassium can cause cardiac or respiratory arrest, anorexia, absence of bowel sounds, muscle weakness in legs, leg cramps, and ECG changes. You can incorporate bananas, avocados, dates, spinach is a really good one, high in potassium and magnesium, and baked potatoes to increase potassium in your diet. In general, I thought your diet was very well balanced. If you were just swapping a few of the whole grains, swapping in a few of the whole grains for the white bread that you consume in the bagels and the sandwich bread, and incorporate a few more veggies into your diet by 2 cups, your diet would be well balanced to include any of the nutrients and vitamins that you were short in. Making small adjustments, like choosing 100% fruit juice or water for sodas, adding veggies or low-sodium nuts for snacks, substituting the whole grain baked chips, or sun chips for Lay's potato chips, and salami for a leaner meat will all increase your vitamin intake and regulate the saturated fats and the sodium. That's a little bit high. Do you think that this might be a reasonable goal for your diet, or are those all foods that you might be interested in switching out?
Yeah, I could definitely do that. I'm going to try.
Okay.